in the intense world of medical emergencies.
One patient, 3 times stab wounds.
There's nothing more extreme than a code red.
This is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, highly specialist teams are ready to react to these major traumas.
ETA 4 minutes.
By road and air.
03, we are lifted from Cosford.
Responding to the most severe 999 calls.
This is going to be tight and painful, OK, but it's going to save your life.
Day and night.
All right, well done.
From car crashes to stabbings.
And he's been hit and stabbed in the head.
Here, where time is critical, lives will be saved.
Everyone clear?
Shocking.
These emergency doctors and specialist paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
I suspect we're going to be cracking open the blood products en route.
Filmed alongside the critical care teams, we captured every vital second as these specialist crews work to save lives.
1, 2, 3, roll.
Tonight, a fall from a ladder leaves a man in agony.
Scale of 1 to 10. 0's nothing, 10's agony. Where are you?
A boy has a severe allergic reaction.
And how does your breathing feel?
And fears a man has been paralysed following a head-on crash. Critical care doctor Hadassah Eilenfeld and clinical support paramedic Ash Mullender are starting a Friday night shift.
You happy for book on?
Yeah, go for it.
No.
No, good evening.
Good evening, mate. Just booking on for the night, please, if we can.
The critical care team are assigned the most challenging and life-threatening jobs. As it's the start of the weekend, the team are bracing themselves for a busy night.
It used to be traditionally our Friday night was a very big trauma night. Through COVID, that settled down a little bit. We are expecting it to pick up again.
Ambulance services, patient breathing.
I'm not sure, there's just been a car accident.
Anyone trapped inside?
Yep. The driver's side of the car is resting against the road on its side, basically. And there's someone in the driver's seat.
Okay, do not move her from where she is unless...
No, you do not move her, obviously, yeah.
We're going to get to her as quickly as we can.
Fire, police and ambulance are en route to the incident. But because of the potentially life-threatening injuries the trapped woman may have sustained, the critical care team has also been dispatched.
99.
And currently we have 1 adult female casualty, breathing and conscious, that is trapped within the vehicle due to it being on the driver's side.
Thank you very much, we're on our way. Driver's side on the road, airbags not deployed. Makes me more concerned that they've not given any sort of report.
The woman is trapped under her overturned car. The critical care team must get there as soon as possible.
Type of incident is a 1-vehicle RTC rollover, currently remaining on its side. Hazard currently is the vehicle is having to be stabilised by fire. There is glass and debris in the road. Other than that, the road has been fully closed by police.
Okay guys, high visors and helmets. Let's go have a look.
Arriving at the scene, it's clear the car has hit a tree on a residential road with such force it has rolled onto its side. The female driver is trapped inside.
Can I have a quick look at her? Is that all right? You carry on.
Fire crews have stabilised the car to prevent it tipping over and crushing the driver.
Can you get access to her through the boot? So if we put the dock in, can she get in through the boot?
Yeah, is that all right?
Dr. Hadassah is briefed by the fire commander. The emergency services need to work as a team to ensure the woman can be freed safely.
Is that all right? Just to get eyes on her and then I'll get out your way as long as we're okay.
First, Hadassah must make a visual assessment of her patient.
I've raised the steering wheel a feet of frame and I've dropped the seat back.
She needs to ensure the woman doesn't have any immediate life-threatening injuries that could suddenly deteriorate when they move her.
Hello, lovely. My name is Hadassah. I'm one of the emergency doctors. How are you feeling?
Okay.
Any pain anywhere?
No.
And do you know what happened?
I was literally passing along and a car hit me.
Okay. All right, fine.
I've done nothing else.
Okay, fine. No pain in your chest or your stomach?
No, nothing.
With the woman conscious, talking, and no visible injuries, the team decide to try and get her out.
Can we get a pair of scissors and just cut the belt? If we cut that seat belt, she might be able to support herself a little bit more. It's if we cut that then, and then we just help get her out.
Her arm is on the floor. We can release it, yeah.
What we're going to do, so a bit of this boot's going to come off, and then we're going to see if you can get yourself out of here rather than us completely cutting the car apart. Would you be happy to give that a go?
I don't mind what you do.
Yeah, we'll make it work. It'll be absolutely fine. You're doing absolutely brilliantly. It's going to be really loud for another second, okay?
It's fine.
Although the woman appears not to be in pain, shock and adrenaline can mask major trauma. Dr. Hadassah needs to get her out of the wreckage in order to fully assess her.
At the minute, she's got no injury, she's just complaining of some pains in her legs. Initial eyeball of her that Hadassah's done, she doesn't seem like there's any massive injuries. So that's why at the moment the fire service guys are just assisting her to get out the back of the car. And then what we'll do is we'll get her straight onto the scoop, onto the back of the ambulance, and we'll check her out further.
I'm happy we don't need to sort of cut everything apart. Okay. If she can get herself out, I think your colleague was just going to see if he could sort of support her getting herself out, and then we can just walk her onto the stretcher.
As they begin to cut the patient free, Dr. Hadassah's told what the firefighters think caused the crash.
I think it's drunk, to be honest.
Okay.
Back at base, critical care paramedics Richard Apps and Alistair McNeil are starting shift.
So, green bag. Red bag has got drugs in it. Yeah. Done.
I reckon we're in for a day of trauma today, Alistair.
Day of trauma. Working with you.
All right, calm down. Harsh.
It's likely their life-saving skills will be in demand today.
Perfect, all ready to go.
Ambulance service, is the patient breathing?
Constantly at the moment.
Is he breathing?
His arm. And he's dead.
Sweetheart, is he breathing?
Yes, at the moment, yes.
What's happened?
What?
What's happened?
Oh, he tried to get up the roof, onto the roof, and the ladder fell.
And he's fallen off a ladder?
Yes. He's hit his head.
And he landed on his head?
He's actually landed on his head and his arm.
OK, we're coming as quick as we can, OK?
All it says on the notes, falling from the top of the ladder from the height of the guttering at a house, but is conscious at the moment, complaining of head pain and unable to feel or move an arm.
6-2, en route.
A fall from height resulting in head trauma has the potential to leave a patient with life-changing injuries.
55-year-old male, can't feel one arm, nausea and dizzy, in the back garden, and he's landed on concrete.
An ambulance has been dispatched, and the advanced critical care skills of Richard and Alistair are also urgently needed.
So 55 is where we're starting to have some concerns with age, but the injury, there's big potential if he's fallen on concrete. He's already reported as having a head injury, so again, there's potential for that to develop and become far worse quite quickly. We're obviously going to have some concern over his spine with that height of fall, so he's likely to end up immobilised and then conveyed to hospital, where he really needs CT scans to see what damage he's got underlying.
When Richard and Alistair arrive, the ambulance crew are treating the man. Retired glazier John was fixing the guttering on his house when he fell onto concrete, hitting his head and arm in the fall. With the potential for spinal injury and head trauma, John needs urgent treatment.
We'll sort out some pain relief in a bit, okay? Sharp scratch now, all right?
We managed to get a blood pressure on him, yes or no? No, all right. I would say that lower arm is slightly deformed, isn't it, I think?
Can you see okay? Don't look around, don't move your head, just have a look around. Yeah? Any blurred vision or anything?
You'd start off with receipts.
Before giving John any specialist pain relief, Alistair wants to establish whether a medical condition could have caused the fall.
And do you remember falling off this ladder? Yeah, that's all right. Just trying to rule out you having a medical event, basically, like somebody going dizzy or something.
Alistair now needs to be certain there are no life-threatening injuries, so checks to see if he has any abnormal sensation or movement that would indicate a spinal injury.
I can't feel my fingers.
Yeah, that's fine.
Can you feel that?
Yeah.
Can you squeeze or not? No, you can't. Oh, it's okay.
John, remember, mate, try and keep the head as still as you can for us, okay? I know, mate. But just try and keep it as still as you can, all right? Now lifting it up, because as well as that arm, you've got a bit of an head injury as well, and you've come from some height as well, haven't you?
Having assessed John, Alistair can now start to get his pain under control.
Right. Have some more.
We're going to get you some pain relief now, buddy, okay?
Well, let's give him at least 5 over a couple of minutes. So do a couple and then another couple more. So it's probably going to take quite a bit of morphine to get on top of this, isn't it?
The critical care team must get John to hospital for an urgent CT scan of his head and arm. But despite the morphine and paracetamol,
Just going to straighten your arm, my friend, I'm sorry.
John is still in too much pain to be moved.
Okay. All right. No.
Covering 5,000 square miles and a population of 5.6 million people, the critical care team work night and day, 24/7.
Just see if we can give him a little bit of sedation and then just get him onto an eye gel.
These highly trained doctors and paramedics attend an average of 20 jobs every day where there is an immediate threat to life.
We'll pick up sort of the cardiac arrest in the area. We're here to target those jobs. But there'll be a fair mixture of trauma thrown in there as well. But you never know. That's the beauty of it, I think. And that's why most of us probably do it, is for the variety of the patients we go to.
Ambulance service, is the patient breathing?
Yeah, I control breathing. I just fell over.
Did the breathing problem come on suddenly?
I've had it for the last couple of days.
Have you ever been diagnosed with an aortic aneurysm or Marfan's?
Yeah, I've had all them 2 heart attacks a lot.
Okay, an emergency ambulance is being arranged for you, okay? Is there anyone with you at the moment?
At the moment, no.
Sending your job instructor, 59-year-old male.
Critical care paramedics Mike Andrews and Kerry Hemus are immediately dispatched.
I've just spoken to the crew. He was found face down on the carpet, GCS-free, agonal breathing.
Nice, mate. Yeah, we're mobile. Cheers, bud.
Agonal breathing, where someone is struggling to breathe, is often a symptom of a serious medical condition. The ambulance team now on the scene found the man who made the 999 call collapsed and unconscious.
So a 59-year-old male who's been found unresponsive. So I think the crews called for assistance as this male patient's critically unwell. According to the notes, he had chest pain all through the night and then he's collapsed this morning. Not very old, is he? 59?
59 now.
The crew have scored the patient on a Glasgow coma score of 3, which means they're more or less unresponsive. So by definition, they're at the point where they may go into cardiac arrest or respiratory arrest.
This is the one.
I'll go. poke my head in there.
I'll follow you in the red bag.
Okay, mate. Hello there. You're right. Yeah. Having a morning, aren't you? Hiya.
We've got John.
Yeah.
He's 50 years old.
Yeah.
He called us this morning for feeling breathless.
Mike is briefed by the ambulance crew.
We've arrived on scene, found John face down in this position.
Yeah.
We've left ourselves in GCS3, unresponsive.
Okay.
It's quite difficult to get a BP reading on him at all.
Okay. Did he have a radial pulse at that time?
Very, very faint radial at that point.
Okay. Jeez,
And he's had a stent following an MI 3 weeks ago.
Okay.
John has recently undergone heart surgery after a heart attack. He is now conscious, but in a life-threatening condition.
Hello, sir. How you feeling? You got any pain anywhere? Do you remember what's happened this morning? No. Do you remember getting up this morning? Yeah.
I thought I went up the telly over, put the telly back on.
Yeah.
I went back and sat on the settee.
Yeah.
And I don't remember nothing after that.
And you don't remember anything after that? Okay. What's the first thing you remember when these guys got here?
No. I don't remember them getting here.
Okay. All right, bud. Your lip's normally quite blue.
John's recent heart operation and his symptoms today suggest he could be suffering with heart failure.
See if you've had a stent 3 weeks ago for a heart attack, yeah? Do you have any chest pain yesterday?
I've had it for the last couple of days,
Do you feel how you are at the moment that you'd be able to slide yourself back?
In Bewdley, critical care Dr. Hadassah is dealing with a driver trapped in an overturned car.
She's not in any pain at all.
Yeah, she isn't, yeah.
She's waving her head about, so I'm not really worried from a C-spine point of view. So I think if we can get her out, it will be better. She's right, she's got no idea what's gone on.
Yeah.
She thinks another car's hit her.
Firefighters have cut the seatbelt that was trapping the woman. Now they can get her out. Dr. Hadassah is able to assess her to ensure shock isn't masking major injuries.
I'm not going to collapse.
Hello.
No.
Hey.
I'm
Now
not gonna collapse,
that you
mate.
can see my face the right way round, my
I'm not
name's
gonna
Hadassah,
collapse.
I know. My
I'm
name's
not gonna
Hadassah, I'm one of the
collapse.
doctors, but you've been trapped for a long time, so come and sit down and let me take a look at you on the truck. Brilliant. Come and switch around because we all want to get out.
I don't want to.
Lovely. The problem is there's lots of glass and stuff in the road, so we need to take a proper look at you.
I don't want to.
Despite having been involved in a serious crash and being trapped inside her car, the driver is reluctant for Hadassah to assess her.
I don't want to.
For what reason?
I don't have a good reason, but I don't want to.
So the problem is, if you can see your car, all of that force that's gone through
me.
I know. So all of that force that's gone through the car has also gone through you, and you might feel absolutely fine at the moment because you've got loads of adrenaline going in your system because you've been through a really scary bit. We might be missing injuries, so we need to take a look at you. Because I need to look at your chest and your tummy and make sure they're okay. So just come and lean back for us. Brilliant.
Could we just check you over, okay? Because it's been a fall involved, so we need to make sure you're okay.
The car hit me.
I know, especially if the car hit you, there's an extra force.
Where's the car hit me?
We don't know.
We're not sure, lovely. All we can see is the tree that we're taken down on the way.
Oh.
Helmets can come off. So we're going to just take a quick look at her and then hopefully straight off to hospital. She's refusing currently, but she doesn't have capacity. She's very, very repetitive. She doesn't know what happened. She keeps saying a car's hit her, so...
With no evidence of another car involved in the crash and concerns the woman has been drinking, she's moved into the ambulance.
Big deep breath and blow. Keep going, keep going, keep going, keep going, keep going, keep going.
Once on board, the woman is breathalyzed by police.
But we have to warn you that obviously if you do blow over the legal limit, you'll be under arrest, okay? Okay, so the legal limit is 35, you've blown 71, okay? So you're twice the legal limit. So at this time, you're under arrest on suspicion of drink driving.
Don't get upset, darling.
I didn't do anything wrong.
Okay.
I didn't do anything wrong.
We're not the ones, darling. We're here to help.
I appreciate you.
Lovely, what's going to happen now is we're going to get you off to Worcester to have another little look at you, okay? Just to make sure everything's okay.
Thank you.
All right. I'm going to leave you with these paramedics now. Okay.
Happy the woman doesn't have any life-threatening injuries, Dr. Hadassah leaves her in the care of the ambulance crew.
So from an injuries point of view that we could find, there wasn't very much on her. The thing is though, we were quite early to the time that the incident happened, and injuries can develop over time. She's also got that initial adrenaline rush of suddenly finding herself upside down inside her car, having gone through a tree, which masks some injuries. So we've got to be a little bit cautious about saying initially that she's got absolutely no injuries. And I think a bit of a look later on at hospital would help reveal any of those that were hiding at the time due to either alcohol or adrenaline or just the excitement of the situation for her. Yeah. Perfect, thank you. See you later. More than happy, see you later.
Two of those.
Critical care paramedics Karen Baker and Tom Waters are preparing to start shift.
Have you looked at the monitor?
No.
The first thing in the morning is just to do the daily equipment check for the specific pieces of kit that we've got, especially with some of the enhanced stuff that we carry, and also with the nature of the patients that we go to when they're very, very sick. You want to be very, very quick at what you're doing, so you want to be able to put your hand on what you want straight away.
Ambulance service, is the patient breathing?
Yes,
And is the patient conscious?
he is.
What
Kind of half and half.
What's the reason for the call?
I think he's having an allergic reaction. Some people are struggling to breathe, and he's saying he can't swallow anything, and his nose is on always swollen.
And has he got any rapid swelling of the tongue or throat?
Well, he said he can't breathe, so possibly his throat, but his eyes are kind of swell up a bit.
And how old is the patient?
11.
Ambulance has all been arranged. We're coming to you as quickly as we can on lights and sirens, okay?
It's a call every paramedic dreads, an emergency incident involving a child. An ambulance crew have already been dispatched, but an allergic reaction can quickly develop into life-threatening anaphylactic shock. This is a time-critical call for Karen and Tom.
It's a 10, 11-year-old. It's just coming in, so we haven't got an ambulance there yet. So we're just we're going to get hopefully a bit more information shortly.
In a severe allergic reaction, the immune system releases a flood of chemicals that shock the body, lowering blood pressure and narrowing airways. Untreated, it has the potential to be fatal. So Tom checks the correct dosage for a child of that age en route.
If you are going to have a true anaphylactic reaction, normally it happens within seconds of the allergen entering your body, and your airway can swell very quickly, and then you can't breathe, and it can quickly progress into a cardiac arrest. Early intervention is key. I'll grab the red bag.
When Karen and Tom arrive, they find the crew have moved the boy onto the ambulance.
Hello.
Hello, Tom.
Hi, you're right.
Callum is 11 years old.
Hi, Callum.
The ambulance crew quickly brief Tom on their initial findings.
When we got here, he was fully conscious and alert.
Okay.
Right, there's sort of very much the focal swelling around the face. Right?
Yeah.
No sort of reduced consciousness or anything like that. No sort of head swelling to the throat or anything like that. But very, very, very short of breath, sort of very tired with his breathing as well, and very weak on his legs.
11-year-old Callum had eaten a nut. He immediately started to feel sick, came out in a rash, and complained he couldn't breathe properly.
We were trying to shake him, so it looked like he was falling asleep.
Any family history of any nut allergies or any allergies or anything like that?
He's had nuts before.
Okay, right then.
So his dad said, oh, I'm going to have, and then he said, can I try it? And then the next thing we know, he's
We've gone down a little bit.
Okay.
Callum has a swollen face, bloodshot eyes, and he's struggling to breathe. Clear symptoms of anaphylaxis.
How does your breathing feel?
It's like, it hurts like it's hard to breathe.
In Oldbury, critical care paramedics Alistair McNeil and Rich Apps are treating 55-year-old John, who is in agony after falling from a ladder.
So we're just giving him some pain relief. This is paracetamol. He's had some morphine.
As well as a likely broken arm, John also had a head injury. Alistair and Rich want to get him to hospital where he can be scanned. First, though, they need to get his pain under control.
How's your pain doing? Have we got on top of it or not, or is it still hurting? Okay. All right. Okay. Scale of 1 to 10, what is it? 0's nothing, 10's agony. Where are you? 10 at the moment. Okay.
Even after multiple doses of painkillers, including morphine and Entonox, John is still in agony.
Okay, I might do something a bit stronger, mate. He's had 10 of morphine, 1 of paracetamol, and we're still at a pain score of 9.
It's going to take a bit of time for the
morph
to
I'm just
kick in,
thinking a little squidge of something stronger like ket wouldn't actually hurt, would it? So, John, I'm going to give you some ketamine in a second, which is quite a strong drug. And then I'm going to give you a small amount, just enough for us to be able to move you, hopefully without you knowing what's going on.
Although it's a highly effective painkiller, ketamine can also have side effects, including hallucinations. So Rich warns John's anxious family, who are watching on.
So it looks like it's just his arm at the moment. He's talking to us and communicating normally, so that's a good sign. Going to give him some ketamine.
Try. Do you want to hold that over his face? Nice deep breaths for a minute, John.
Deep breath, John.
Deep breaths.
Just like that. Brilliant.
That's all right. That's the drugs that we've given to you. Just going to roll you over in a second, John, and get you off to hospital. So let's start working around, getting a scoop in.
With the ketamine taking effect, Alistair and Rich prepare to move John onto the scoop.
All right, John. All right.
So I've got hold of his waist, I've got hold of his upper arm here.
Oh, man.
That's in. Okay.
I felt that.
You felt that, did you?
When the ketamine wears off, John will remember the fall, but not the pain.
What's going on?
They're just popping you on a stretcher, John. You're all right, chap. You're all right.
Stop it.
How are we then, everybody?
We're going head first.
Head first.
Just watch those slabs because they're wobbly.
Okay, all right. Everybody happy with the backs? Yeah. Okay. Right. Ready. Steady. Lift.
In case there are any side effects from the ketamine, the critical care team will continue to monitor John on the journey to hospital. He will need an X-ray to check for any broken bones and a CT scan to assess his head injury.
This is my house.
It is your house. Watch the elbow. Yeah, I've got it.
In Tipton, critical care paramedics Kerry Hemus and Mike Andrews are with a patient who recently had heart surgery. He is struggling to breathe and was found collapsed by the ambulance crew.
You've still got no pain anywhere at the moment, John?
No, nothing at all.
59-year-old John had been having chest pains 3 weeks after undergoing heart surgery. He managed to call 999 before collapsing.
Do you think he's stable enough to roll him this way? Right, because away from where he is, put the scoop behind him and roll him back onto it. Listen, sweetheart, we're going to help you, all right, but we want you to roll you this way.
The way John is breathing could be a sign of heart failure, so it's important they get him to hospital as soon as possible.
I've got your head. Now we're going to roll you onto it. It's quite cold, this board is all right. Okay, we're going to roll you back onto it. So pull it underneath him as well at the same time. Perfect. Right, let's just straighten you up on here. Lovely.
Are you comfortable? You got something under his head?
Yeah, I'll get another blanket. If you cover him up with that one, I'll go and get another blanket. There we go.
Have you spoken to the desk, mate?
No, I will do.
I'll probably travel with.
Put an alert in on the way.
Yeah.
As he travels to hospital, John will have his breathing, heart rate and blood pressure monitored at all times.
Mind your toe. Who says we don't do some lifting, eh, Mike?
As John is at risk of going into cardiac arrest, Mike travels with him in the ambulance to hospital.
There we go.
OK. Were you short of breath yesterday, John?
Yeah.
Yeah. And
I've been last couple of days.
have you really? Try and relax your breathing just a little bit if you can. Take a bit of a deep breath and then hold it in. I know you feel like you can't breathe much. Good man.
84 to the 63 DT.
See you there.
All right.
All right.
Hello, Samuel. Can we put you on alert, please, for a 59-year-old male?
As the patient is high risk, Mike phones the hospital to brief them in advance.
Found unconscious this morning. It's a collapse, but he's severely short of breath. So he's 3 weeks post-stent. The working diagnosis at the minute is heart failure or query PE. And we'll be with you in about 8 minutes from now. Is that shortness of breath feeling any better now?
I don't feel too bad, no.
No.
The oxygen he's been given has helped John's breathing, but he still needs urgent assessment.
Right, we've arrived, so let's get you in now.
Mike and the crew safely hand John into the care of the waiting specialists. They will fully investigate why John suddenly collapsed so soon after heart surgery.
Lovely.
It's the start of another shift for critical care paramedic Ian Locke and his crewmate Peter Bowles.
What can I help with?
We're almost done, mate.
It might be a midweek shift, but the critical care team expect to be in demand.
Ambulance, patient breathing.
I don't know, he's just lying on the floor.
So what's happened then? You said there's...
He just come scooting up the road and they just smashed into each other.
Can you see if he's breathing for me?
Yeah, he's breathing, he's talking. Come on, Chick. Don't shut your eyes. Don't shut your eyes.
Is he wandering away now? Is he speaking to...
No, he keeps going in and out.
An ambulance has already been dispatched to the crash.
About 5 calls on it, and we're coming through his Cat 1, infant's unconscious.
A Category 1 call is classified as life-threatening and needing immediate intervention.
Yeah, roger that, mate. I'll change you to 81 now.
Almost 26,000 people a year are severely injured in road traffic collisions. Over 1,700 are fatal.
There's 5 calls and query 1 patient trapped and or unconscious. We just had a very quick update saying there is a crew in attendance.
2 cars have crashed on a residential street. Ambulance crew are treating a man found lying in the road.
Yeah, buddy.
Yeah. So driver out of this car.
Yeah.
Apparently he's up and walking around.
Okay.
Said she's happy.
Operational manager Chris Bayliss, overseeing the incident, briefs Ian.
And this guy who's like flat on his face.
Yeah.
Apparently he's got out of that car, out of the Civic.
Yeah.
He's walked 2 spaces and collapsed.
Right, okay.
Apparently he's got some pelvic pain.
Right.
He's had previous fractures to his spine, etc.
Okay.
It's got he's talking to him.
33-year-old Aaron was driving when he was in a head-on collision with another car. He is now complaining of back pain and a loss of feeling to his left arm.
Hello, guys, you all right? What do I call you, buddy?
Aaron.
Aaron, my name's Ian. I'm one of the other paramedics been sent. All right, I know the guys have been to you. Do you remember what happened?
Yeah.
Yeah. Take a deep breath for me, mate. Okay, yeah. I'm not pushing hard, mate. There we are. Yeah. Wiggle your toes for me. And can you just... You can feel your toes? Okay, so what happened to you before? What have you done to your back? What happened?
I broke my L2 and L3.
Yeah.
And last year, I was in a car for 5 days as well.
Last year? Okay. All right.
Having previously suffered a brain trauma and with recent major spinal surgery, Aaron is worried he may be paralysed.
So,
this one?
No, my other arm.
Okay.
I can't feel it. Yeah, completely numb.
In Albury, critical care paramedic Tom Waters is with 11-year-old Callum, who has suffered a severe allergic reaction after eating a nut.
Can we sit you forward, buddy? Is that all right? Hold my hand. Let's go have another listen to the back of your chest. How's your hands? Do you feel cold?
Callum is struggling with his breathing. His face is swollen and he's come out in a rash. Anaphylactic shock can be very serious and needs to be treated quickly.
It's had 300 grams of it already. We're starting to feel a little bit better.
Okay.
We were just going to try and get a candor in to give some chlorphenamine.
Yeah.
As well.
Okay.
And you guys turned up.
Perfect. And tongue-wise, can you stick your tongue out? Let's just have... Does it feel swollen? No, that feels right. Just go for me. Okay.
Restricted breathing from an allergic reaction is usually triggered by swelling to the tongue or throat. Tom needs to continuously check that Callum's airways are clear.
Can you give chlorphenamine IM?
Yeah, we can do.
Yeah. I think keep on with the nebs. I think chlorphenamine sounds like a good... We're going to have to give you another little stab in your arm if that's okay, buddy.
Chlorphenamine is an antihistamine drug used to slow down an allergic reaction, blocking the signals being sent round the body.
Yeah, sharp scratch again, so it might sting.
The drugs Callum's been given will soon start to work, so it's important that Tom finds out how severe the allergic reaction was to start with.
He ran outside, was sick, and then it kind of flopped and...
Right, okay.
And then we didn't notice his eyes until 5 minutes later, and then I've kind of panicked.
Okay. And is that rash getting better now?
Well, we only spotted it
as you took it. It's exactly the same.
Yeah, just as you called up.
It doesn't look any better, but it doesn't look any worse. Would you agree with that?
Okay. Should we just do blood pressure? So, in regards to seeing how, if his reaction is getting worse or better, a good sign would be to tell how his blood pressure is getting on. That's going to go quite tight.
You know what we did the first one?
The ambulance crew have given Callum adrenaline, which will increase the blood flow through his veins, helping to relax the muscles that are swollen and blocking his airways.
If his blood pressure is relatively low, then I think we'd be inclined to give maybe some more treatment. But if his blood pressure's okay and he's not getting any worse, then that's kind of more reassuring for us, really.
Got down a little bit.
Okay.
It was 130.
Yeah. But he has had some of your adrenaline.
But he has had some of it.
Yeah. Okay.
You're all right, mate.
The best is doesn't tell you, kids.
Allergic reactions can last for hours, so the team will need to continually check his airways and blood pressure to ensure they remain safe.
Just stick your tongue out for me again. And doesn't feel swollen at all?
It's a little bit like the same, but it's not as bad.
Not as wheezy.
Although the drugs given to Callum seem to be working as he slowly finds his breathing is easier, he will still need hospital care.
You feel better?
You look better. You looked a bit whiter.
You sound better.
Got a better colour about you. Obviously, he'll need to go in. Like, I'm sure these guys will go in.
Yeah.
Because what the medication they've given might not last as long as the allergic reaction lasts, so there's always an element where he needs to be monitored for a period of time and things like that. But I think from our point of view, you don't need us. And are you happy with everything? So,
Yeah, absolutely. We've got the stuff ready.
Yeah, absolutely. So I think you probably nipped it in the bud of the adrenaline early on.
Tom is confident Callum is stable enough to leave him in the care of the ambulance crew for the journey to hospital.
Awesome, brilliant. No worries. Okay, we take care. Bye. Allergic reactions can be very serious, and sometimes an anaphylaxis reaction can almost be uncontrollable. A true anaphylaxis reaction is very time critical and life threatening. And I think, to be fair, that child probably wasn't far from that. He had all the kind of characteristic signs. Those are the really challenging cases.
In Smethwick, critical care paramedic Ian is treating a man involved in a road traffic collision who has collapsed and is worried he's paralysed.
Can you move that arm at all?
No.
Okay.
33-year-old Aaron broke his back 3 years ago and had extensive spinal surgery.
I just thought, get something ready for that arm. Does it look hugely deformed, or? I had a quick feel down. He's got a good bilateral entry, he's got a stable pelvic ring, and his legs are intact. Just relax. You haven't got a spinal injury, okay? You haven't got a spinal injury. Yeah, that's fine. Good skills, all right? We are going to have to roll you to get you on a scoot, though, okay? So we can have a better look at you, all right?
Whilst Aaron is given pain relief for his injured hand, Ian checks for any more serious injuries, including nerve damage.
I'm just going to gently touch down your legs. Just let me know what you can feel. Just say yes, all right?
That's all fine.
Yeah. Okay. And this one?
I know you're touching it.
Yeah. Okay. All right. Yeah. Don't worry. That's fine. That's fine. Now listen. You have not got a spinal injury. It's whatever's happened to you before is not the same as today. Okay. All right. Yeah. Okay. Slow, deep breaths. All right. You are going to be fine. We'll get you some pain relief. You may have hurt that arm, and we'll get that sorted for you. All right.
Ian is confident that Aaron is stable enough to be moved into the ambulance.
Aaron, I'm just going to move this arm gently up, okay? We're going to literally... There you go.
That's it. Just be careful of that in your arm.
So have you got the head?
Yeah, on your shout then. As best I can.
Yeah.
Just go slow, please.
Yeah.
Breathe. You've got to breathe. Okay, nice deep breaths, yeah?
Yeah. Okay.
I'm ready. You're calling.
You're calling.
Okay, ready, steady, roll. Well done, well done.
There you go, relax. Yeah.
No, you did great.
Aaron, you're a legend. Well done, man. All right. We're going to get you up off the floor and get you in the ambulance.
Yeah, I'm calming down.
Yeah, that's okay. Honestly, mate, you've been in an accident. If nothing else, you've been in an accident, okay? So don't stress about it, mate. Okay, on lift. Ready, steady, lift. There you go.
Ian calls to update the trauma desk.
7260, Roger, go ahead with the update.
Thanks, Colin. So this is a male. He was driver of a car involved in a head-on RTC. On our arrival, GCS 15 lying prone on the floor. He's got an extensive spinal history. He's had operations to a previous burst fracture. So he's complaining of lower back pain, some numbness to his left leg, and pain in his left arm. We've rolled him over, GCS 15, the crew just getting some wobs and IV access. The plan will be sand well over. I think given to how well Aaron is now, you know, he's obviously got to go and get x-rays and anything else they need. But yeah, mate, don't. Mate, with your history, that is fully understandable, mate, yeah? Don't worry. Of course you do. Don't worry. Right, they will take care of you. Happy, guys?
Yep.
Thank you very much. We'll get out your way. All right, take care, cheers.
Thank you.
Excuse me, what's your name, mate?
Ian.
Thanks, Ian.
Aaron, mate, you're more than welcome. Take care, buddy.
I'm lucky, mate. You've got to...
We sent him to a trauma unit up at Sandwell, where he'll be assessed in ED there, and they've got the capability to certainly X-ray and also get a CT if they find anything or they're unsure about anything. So he'll get the relevant care and assessment and imaging he needs. He's obviously had the shock of his life. His day's gone from normal to upside down, and with his history, I think he's very anxious, but hopefully it'll be nothing significant.